Hi, and welcome to the Alliance Core tutorial demo of the Tier 2 service that Early Learning Ventures provides. This is going to walk through all of the basic steps a provider typically uses for a demo. Let me go ahead and screen share. So the Alliance Core system itself is just a website. So a provider does not need to download or install any kind of device or software as long as they have internet access and something to access the internet on. A provider is welcome to use whatever devices they already are comfortable with and have. So this could be a lot of times with a demo, we recommend desktop or laptop just for Zoom screen sharing, as well as on the core orientation trainings with our support team. And afterwards, if a provider is comfortable with it, we do have mobile apps as well for Android and iPhone too. So the whole system, big picture, streamlines quite a bit of the day-to-day operations a childcare provider goes through on a daily basis, regardless of their size. So if they're a family childcare home, they can use it. If they're a large center, if they can use it. If they're an authoritative association or hub of several different organizations, they can use it as well. So the whole system can accommodate for quite a bit of different operations the provider may be doing and not housing all in one spot just yet. So from everything with child and staff check-in and check-out to online enrollment to document store to parent communications, food program tracking, etc. So if that is happening in different platforms, essentially, this does house them all together. So we'll start with our kiosk here. Let me log in. So this is the screen that will be pulled up on any device the provider is comfortable with at time of check-in and check-out. Again, this can be a tablet, it can be a phone, and it can be a computer, whatever the provider has already. And if they don't currently have a device available for this said kiosk screen, this can be done on an Amazon device as well. So a budget-friendly recommendation I have is a Amazon Fire tablet as well for download and purchase as needed. So when it comes to check-in and check-out, the provider and guardian has the option of scanning this QR code through their app on their phone. If they choose to go contactless, scan that QR code and go the exact same steps as it would be for typing this security code in. So the security code is individual per provider. Mom and dad don't share, grandma, grandpa all have their own, etc. So process works the same way, regardless of which way they choose. So for today, I'll type my code in and click on the blue check-in button here. So let me approve some attendances out to get our screen pulled up correctly. So this is the screen a provider, or I'm sorry, a parent or guardian will see at time of check-in and check-out. They will see who they are logged in as, the day and the time they've arrived, and a list here on the left of all of the children they are authorized to pick up and drop off. So the system will let me mass select everybody if I have everyone with me this day, or I can individually check a child in or out as well. So you'll see that we have temperature checks and health checks turned on. If you choose to use those, it's just going to ask the guardian to type the child's temperature in and turn this toggle on the left if the child's been sick or been around anyone who's been sick. So we'll go ahead and check one child in for today. Click on that green button. We've successfully done so. We will then click on close and the screen is brought back to the home screen for the next set of parents or guardians to come by. And you'll see the staff check-in and check-out feature as well. If you choose to, this can be used as a punch clock. So staff will have their own codes, just like parents have their own codes. They can be clocking in and clocking out of different rooms throughout the day to total staff hours worked as needed. So just a side note, the system does not correlate with any payroll processing system at this time, such as ADP, automatically. So with that being said, if you do choose to use this as a punch clock for your staff, you will then just run a report through the back end of Core, which we can get to here towards the end of this demo, to see the total hours worked to use for payroll processing elsewhere. Otherwise, Kiosk is pretty straightforward with simple usage of check-in and check-out of both children and staff on this screen. So we'll move over to the back end of the Alliance Core system here. Make sure you're on the Core drop-down toggle of this website. We will log into our demo environment and be greeted here by our provider dashboard login screen. So everything that you're going to see here on the demo today, you as a provider will have access to from the get-go. It doesn't mean you have to use every single thing that you're going to see on the screen or that I'm going to go over today. It's just up to you to choose what you want to use. You never have to pay more to access more features or stay a longer amount of time with ELV to unlock more modules. If you use one or two things, great. If you use everything, great. That's just your personal preference. So on this dashboard, the system is giving you a high-level overview here of everything that system is tracking for your program. So staff to child ratio numbers, attendance percentages, and enrollment percentages. And then here in the middle and on the right, it's letting you know with an everyday alert of something needing your attention regarding child or parent alerts or parent or staff. So this could be medical expirations or immunizations coming due. So as long as dates and documentation have been entered into core prior to now, the system is tracking that for you. So you don't have to be doing so on paper calendars. So if I click on medical expirations, for example, here in this column, it's letting me know what's missing entirely and needs my attention or the date associated with something expiring. So if I double click on that February date, the system flags me in the highlight on the right what piece of that child's file needs updating. So then it's just up to me as the provider or as my staff to outreach to that family to gather updated data. If that's a kiosk message, email, text, face-to-face, whatever you choose. So also on the dashboard, you will see today's activity information based on who all is checked in to which classroom and at what time, who's absent, birthdays as well for children and staff, and room ratios down here at the bottom. So again, just some more real-time data based on what's going on at this time at your program. We have a room change feature also. So depending on how large your center is, and you're moving children throughout classrooms throughout the day, I have the option to mass move children out of a classroom and into a different classroom throughout the day, record that change and notate the time of move also. So as often as you need to use that. So after a demo with our client support team or this video, for example, you are welcome to essentially, if you want to sign on with the system, we will pass you off to our client support team, and an individual member of our team will be walking you through best practices, some guidelines, and next steps of the Alliance Core system for setup. So since that's different for a lot of people and not everybody has the same priorities and what they want to do out of the system for second and third, we let you tell our team what you want to work on first, if that's online enrollment or if that's billing or if that's document store. So depending on your own action plan of what you want to do is how our team tackles the next steps of onboarding with you to get your account set up. So a lot of times, though, that does end up being online enrollment. Since our system doesn't have a way to mass export current existing children's files data out of another childcare management system or from any other software that you've been working on into Core, and we prefer that you don't have to manually enroll a child into the Alliance Core system on your own. The easiest way is online enrollment. And there's a few prep steps for that. So all online enrollment is setting up an email template so that every family receives identical information, sending an email to them with a link that enrolls the child online. It's just a quick 3 pages, and then you're able to mass send that out to your families, and they do the data entry on that child's behalf. So you and your staff do not have to. So since that is very common, one of the first steps the provider would like to do inside Core, we'll start there. So there's a few prep steps, as I mentioned, one being your provider primary information page. So basically just a profile on your program with standard contact information, license number, license type, hours of operation, meal times as applicable. You'll also fill in schedule templates here. So however often children attend, if that's Monday through Friday full-time, part-time or drop-in, get as many variations of this as you need entered in. So through the enrollment process, you can assign the child to the schedules you've created. And same with your room setup. As a home, you may just have 1 or 2 rooms. The larger the center, the longer this list. No worries. So give each room a name, notate age requirements, licensed, and preferred capacities as well. And the last prep step is our document store. So it really is just another version of a Google Drive or an online cloud to upload documentation into, broken out into sections of provider documents, staff, parent, child. So within provider here, this is a list of information we recommend uploading as your time allows to do so. But first and foremost, being your parent handbook. So if you upload that, grab it from your computer files and upload accordingly into Core. And that's it, prep step wise. So to create your online enrollment mail template, we'll click on enrollment here, click on this first tab for mail template. And this entire template is completely customizable to your liking. Right now, it's filled with some pretty generic information that you're able to change and alter as you'd like. So we will go ahead and click on attaching that parent handbook once we've uploaded that into Core to automatically include that attachment in the email these parents will receive. And then you can change this to your own business name. You're welcome to attach additional files as well. If you're needing something site specific that our application does not have, feel free to do so here. And then you can customize the invitation email body. So right now it is generic, as I mentioned. So it greets families, tells them about Alliance Core, tells them to create that security code and what that will be used for. It then will have a link to the application itself, which we'll walk through next together, and signs off with your contact information. So once that is all typed in and up to your liking, you will click on save to save that template out. And to send this to your families, when I go to enrollment invitation here, there's a couple options. So I can click on add and simply type in that parent email address one at a time and hit send, copy and paste into this entry field if I already have a list of parent addresses at the ready. Or that first profile that we created at the beginning will create a link at the top, and you can mass send out one link out to everybody if you have 100+ kids or something like that. So what that application looks like after the parents have received it, you'll come here to review and approve, see who all you've sent said application to and the status of the application. So if it's in process, still with the family, approved by you or your staff, waitlisted, or pending. So on our pending approval application here, we'll walk through this to show you what that looks like. So again, data entry has been done. You're just reviewing it and filling in any staff only information. So you will complete that start date, review parent and guardian basics information, click on next. The family will have filled in emergency contacts and authorized pickups on this page. Click on next. And then this third and final page here has some more staff only info for date of enrollment and that start date. You will click on the drop down to assign the child to the attendance schedule from what you've created, and same with the classroom here. And then again, reviewing data for child's medical info that's already been entered in for dentists, doctors, and hospital. And here is our quick and easy authorizations list. So rather than bulky paperwork packets and signatures flying around, parents simply authorize this information with click boxes. Excuse me. And additional information can be filled in as needed for information like that. So very easy, very quick authorization list here. And at the very end, you'll update this processing status accordingly. So we have the options to approve it out, store everything inside Core, bump it to in process, give parents edit access again, reject or close if you simply cannot accept that child for any reason at all, and waitlist if you don't have the space just yet to accept that child. So if you do waitlist, that information they filled out will still be on hand, and you can always approve it when the spot opens up. You don't have to send the application out to them again. So once it is approved, again, it will all be stored inside Core for years to come. There's no necessary need to print things off unless you want to for second copy preferences, and it's very easy right here on the screen. If we click on View the Online Enrollment Report, it will create a PDF of everything filled in on that child's behalf. Let me zoom in just a bit here. So you're able to print this off, file this away as you'd like to. This form does capture an e-signature on the parent handbook, a physical signature with this physical signature here, and a parent timestamp as well. So that is, without a doubt, the easiest, most time-saving way to enroll a child through Alliance Core without the provider doing manual data entry. But we do realize tech is not everybody's forte. They may not be the best at filling this out. They may need support. You may want to do this as a group. You may want to do it on your own if you've recently asked them to do something like this. Whatever that case may be, that's okay. You do have access to manually enroll a child if you don't want to go the online enrollment route. That being said, if I click on child setup, click on add, you do, as a staff member, as a provider, or as a teacher, have access to enroll a child based on paper applications you already have and fill out this empty application if you choose to. Yes, it's going to take some more time, but if that's the route you go, that's totally fine. So while we're on the topic of what parents have access to, I'm going to hop to our parent portal here. This is desktop version. There is that app as well. All the parents need for login is their security code and their email to log in here. This really just takes staff out of being middleman of documentation updates and things like that. So this puts core very accessible in the palm of their hands or on their computer for parents and guardians to access. So they can update contact details if anything has changed from this initial application they filled out. They can add or remove authorized pickups on their own also. So if anybody needs removed or added, they can keep this list as up to date as possible for kiosk access. They can also improve attendances. So if mom or dad, grandma, grandpa were in a hurry and simply did not stop by a kiosk on the way out of a day for checking out a child, and a staff member did so, that will flag the family. This child was checked in or checked out by so-and-so, and they can approve that out for accuracy. We also have that documentation portal. So similar to how the providers have it on their end, parents and children have it on their end as well. So if you have reached out, you've saw that medical alert come up or the immunizations alert come up, and you've reached out via whatever communication method you prefer to gather said updated data, parents can update that through their provider portal or their parent portal. So under child, if I click on this to decide which child, I can update immunizations straight into the portal or medical records as well. And you are informed as a provider when information has been uploaded. So next, I will hop over to our billing piece. I'll keep this pretty straightforward. It could be very customizable. Every provider does billing different. So big picture, our billing module can accommodate for weekly, bi-weekly, and monthly billing. Those are options that you can provide. And we can do cash, check, credit, debit card, and ACH as well. If you do choose to go the electronic route, we work with a third-party vendor called Payrock, Payroc, and they will set you up with a quick onboarding process to obtain a merchant ID and a merchant key. And there is a convenience fee involved with electronic payments. You have the option to either relay that fee onto the family or to cover that as a business. It is pretty minimal though, 3% or less for the convenience of paying online, and a flat 45 cents for ACH transaction. We do also have the option to turn on right up here, extended hours auto billing. So if your families are in routine of picking up late and you hate having that conversation over and over to be on time, essentially, you can be charging $1 a minute, $1 every 15 minutes, whatever you choose for late pickup. So the kiosk will know at time of checkout, one, if a parent is late, and two, how late they are, to automatically add a one-time late pickup fee to that family's ledger, just as a way to maximize income if that's an issue that you're having. So typically with billing, providers will create recurring and one-time charges. So what that looks like is setting your own amount to a ledger title we already have of 5-day full-time childcare, 4-day, 3-day, or you can use your own ledgers, create your own titles and assign those amounts to that. You can mass assign that charge to a schedule of children or to a classroom of children. So what that will look like on a bill or a billing ledger, as we call, is similar to this screen with the amount, the balance, ledger title, type, who the child's information is for, etc. So this can get pretty complex if you'd like it to be, or pretty straightforward depending on your needs of billing. So you can give yourself a 3 or 4 day grace period to review this information before it sends it off, add any last minute payments or charges, or automatically have this auto generated based on the billing cycle that family is on with weekly, bi-weekly, or monthly. If I do need to make any changes, I can add an entry here. Say someone paid last minute in the form of a check, notate the amount, that check number, assign it to the child, save that out. If they paid even via cash, you can do the same thing. We even have it to where you can add in subsidy payments or any kind of electronic payment with Venmo and Zelle. So however customized or detailed you need this to be, some providers just use it to record cash and check. Some use the full-fledged electronic billing. So if and when billing is needed for your program, our team will do one training in itself on billing for you to make sure all of your individual T's and preferences are accounted for. So when it comes to communication pieces, we have kiosk messaging, emailing, and texting. So a kiosk message, for example, is seen on this screen. So for example, if a family member isn't great at checking emails or texts, you can have a message being seen at time of this screen. So if they scan in or type their code in, they have to acknowledge reading a message from you before they can continue checking in or checking out. And then email and text, both are pretty straightforward. The only difference between desktop version that you're seeing now and mobile communications of these features is that this is one-way communication from the desktop. So you can mass send out emails, messaging to parents and staff with a newsletter link, or mass send out text messages as well. On the mobile side, though, it's very comparable to Brightwheel with daily reporting updates. If you and your staff have the app downloaded and parents and guardians have their app downloaded, you can communicate throughout the day as you choose to with photos of a child, comments and kudos of them throughout the day, medications administered, bottles fed, diapers changed, and things like that as often as you choose to. Again, the more the merrier in terms of documentation upload. You can upload inspections and drills, and the more dates and documents that you do upload, the more helpful the information is going to be in the system's tracking dates for you. So the last section here we'll cover is reporting. So based on all information the core system is tracking for you, you can run a report on that information. So right now it's alphabetical. You can always use the search filter to narrow down said information, or clicking on the drop-down category to narrow down by topic. If you're confused, you're like, that's a lot of information in general to sift through and know what I'm looking for. The higher this run count, the more popular that report is run by other core users. So feel free to use that as a fun tool to see where to begin or where to start. We also have scheduled reporting. So different from the dashboard alerting you every day with an alert, scheduled reporting automatically sends a report somewhere, sometime that you've set up. So similar to how if you have auto pay turned on for bills and rent that's due or things like that, you don't have to actually go in and make a payment. That's automatically being done for you. Reports can automatically be run for you as well. So if you want to send immunization records to a nurse on the first day of the month, or your billing statement reports to a finance person, any already existing report can be set up for scheduled reporting to stay even more up to date with compliance and licensing. And then our last section here is dynamic reporting also. So you are able to make reports that don't exist. So if you need some support on that, feel free to ask our team. But if you need something that exists or that doesn't exist in a report, we can make it exist in a report. So if that's you're applying for a grant and you need some specific child demographic information line by line, we can build that out for you. Or if licensing is asked for something that they've never asked for before and you don't know how to pull that information, just let our team know. We can walk you through that and help you build that report out, and it may end up being beneficial to other providers as well. So that is just a very quick high-level spin of the Alliance core system itself with some basic key features to highlight most of the information providers do use. So if you have any questions, feel free to reach out to our team. Our client support contact is ELV client support at earlylearningventures.org. Thank you so much for your time.